Good to go? Well, thank you so much, everyone, for being here with us this morning. My name is Aaron Baer, and I am president of Center for Christian Virtue. We are a Christian public policy group located here in Columbus, Ohio. And I'm going to make it real simple about why we're here today. We're here because the marijuana industry thinks Ohio voters are stupid. They think that we're blind to the realities of what marijuana has done in states all across the country. The bottom line is it's irrefutable at this point that marijuana is a disaster for all these states that have legalized recreational use. You look at headline after headline after headline, whether it's the business community and the hardships they have of finding individuals who can pass a drug test, whether it's kids who have accidentally taken these candies that are designed to look like your normal candy and have ingested these and suffered unbelievable consequences to their health and safety long term. Whether it's traffic safety and the massive increase in traffic deaths as a result of drug use, of marijuana use. Or most importantly, and this is what hits home for Ohio right now, whether it's opioid use. The bottom line is, while not every marijuana user goes on to use opioids, basic 95% of opioid users start with marijuana. We have just had record opioid deaths in the state of Ohio this last year. COVID has wreaked havoc on our communities and has led more people back into drugs. And the solution that the marijuana industry wants to do now is put more drugs into our community. So for those who think that marijuana is a done deal in the state, I'm here to tell you, you are dead wrong. Because the story is that the lies are known. The marijuana industry is not going to be able to fool another state. It is not going to be able to fool Ohioans with their lies, their empty promises of what marijuana will do for our state. The tax revenue is not true. The harmless effect of it is not true. The reality, it brings devastation. And what you're going to hear today from our friends up here is the truth about what marijuana has done and why Ohio is going to reject this resoundingly. They tried to make drug possession easier to get in 2018. We beat that 2-1. They outspent us $16 million to $2 million, $3 million. And it went down 2-1. Marijuana is going to meet that same fate. Recreational marijuana is going to meet that same fate in Ohio if they try to bring this to the ballot. So they can come here and waste their money, but the reality is their lies will not flow here in the state of Ohio. I'd like to bring up our policy director at CCV, David Manhan, to speak a little bit to the issue.
I'm so excited to see this turnout today. Folks standing from all over the state of Ohio against recreational marijuana and for children and families. I'm born and raised in Columbus, Ohio, and my granny used to tell me, boy, if three people say you're drunk, sit down. And what that was if I'm under the influence, or somebody's under the influence of anything, it would be wise to rely on the wisdom of somebody who's got an unpersuaded perspective, and maybe some life experience to kind of help guide me as to what the next steps should be. That's what we've gathered these folks here today to do, is to give you a perspective from the education fields, from the treatment and prevention fields, from the medical fields, from law enforcement, parents, from our ministerial fields. And so to let us know what is going on, what does the landscape look like with marijuana and addiction right now, at a time in Ohio where we are at a 10-year high for opioid deaths, when we are experiencing right now a mental health crisis, when we're experiencing crime, unprecedented crime right now. The fact that somebody in the state legislature would determine that this is a good time to introduce more Schedule I narcotics into our streets. They would introduce more high-potency THC products like gummies and brownies and things and also an industry that is drawing in millions upon millions of dollars to lower the stigma behind drug use, especially marijuana. The fact that somebody would think that that's a good idea right now is problematic to me, as I would say most people standing behind this platform. We are dealing with nothing less than an addiction for profit industry built upon the backs of the most vulnerable citizens, namely children in the state of Ohio, and we are here to stand against it. I think right now we'll start off just hearing the perspective of a mother. How many have children in the room? And so what we want to do is hear from the perspective of a mother. Also, what we want to do today is hear not just anecdotes from, one that was helped or one that was hurt, but we want to look at 8 to 10 years. We've got 8 to 10 years of data in states that have already legalized. These are new, there's headlines. All that you see in front of you right now are headlines from legal states like Colorado, California, Washington, New York. We don't need to be talking about philosophical reasons for or against how harmful or lack of harm that 4, 3, 5% THC is. We're talking about 70, 80, 90% THC products right now that are being pushed to our children from organizations like Big Tobacco, Big Marijuana, and Big Alcohol. So, Corinne, could you please come and share your story?
My name is Corinne Jasper, and I stand before you today as a bereaved mother. Our lives changed forever, July 24th, 2012, because of a marijuana-impaired driver. I had the most beautiful and beloved 22-year-old daughter with a heart of gold. Jennifer was just beginning her amazing life after graduating with honors with a degree in intelligence and analysis research on a lacrosse scholarship. Then one evening, Jennifer was making her way to work when a 26-year-old man driving high on cannabis ran a red light at 82 miles an hour in a 45-mile-an-hour zone and crashed into my daughter's car as she crossed through a green light, excuse me. Her car was impacted so hard it flew across an intersection, across the parking lot, straight through the front of the garage doors and center beam of a loop stop building. My daughter had so much to live for, and she was so looking forward to her future, as was I, with great enthusiasm and passion, but that was not to be. Jennifer's life came to a screeching halt. She was killed due to the criminal and irresponsible act of one man driving impaired on marijuana. He admitted using marijuana that day. The people at the scene said he was so impaired, his eyes were totally glazed over. And as he exited his wrecked car barely scathed, he said he had no idea what happened. He didn't even know another car was involved. I grieve my daughter's senseless loss every day. I miss her tremendously, and I think about the life that she never gets to experience. And to top it off, our family was destroyed. This tragedy was totally avoidable. I would soon learn from the police that the 26-year-old man that killed my daughter was using medical marijuana given to him by the state of Michigan as he was crossing through our state. These types of horrible outcomes from marijuana-impaired driving are becoming more and more frequent. In fact, it's doubled over the last decades. It's estimated that another 6,800 marijuana-impaired driving deaths will happen this year if legalization continues on this path. More and more people will use with legalization, and more people will be driving impaired on our roads. Some believe a medical marijuana card means you can drive high, or it's a get-out-of-jail-free card. In the case of my daughter's killing, the man received a reduced sentence of 2 years. He pled it down, and he only spent 15 months in jail for killing my daughter. An online survey conducted with the Department of Transportation said 69% of pot users admitted driving high, believing that it actually didn't affect their driving ability. It's estimated that 12.6 million people have reported driving under the influence of marijuana and other illicit drugs. I never imagined something like this would happen to my daughter. I always tried to keep her safe. And I am sure you believe the same about your family. But it can happen, and it does every day. We need to do everything we can to keep our roads safe for our families so that they don't get that knock at the door from the law enforcement. This is just irresponsible to allow legalization to move forward. There are studies like the Colorado Rocky Mountain Heights report that shows fatalities go up sharply. There are no safeguards put into place before they legalize. People are even told by the pot industry that they drive better and slower. Totally untrue, as you can see in my daughter's crash. Let alone the fact that most people are unaware of drug interactions with marijuana. We need to do a better job of detection devices, such as oral swabs, and better training of our police. We need strong laws to protect the innocent. We need to limit the strength of THC permitted in the dispensaries, not make it greater. Then there are the edibles that take up to an hour to digest and get to the brain, and they have no warning labels on them. In many cases, because of the delayed response time, the user actually uses more than the single dose. I mean, who eats just one gummy or one bite out of a cookie? Then they get in their car, and a short time later, they find themselves totally impaired and turn into a killing machine. Today's marijuana is almost 10 times as strong as in the 70s and 80s. Believe me, it was an awakening for me when this happened to my daughter and I learned about what today's marijuana was. You wouldn't even recognize marijuana if you saw it. We must look at all sides of this issue and do what's better for the greater good, not the small population that wants to freely use. Where is my daughter's freedom right now? I know my daughter would have made great contributions to our world if she had given a chance. I urge all of you to speak up against recreational marijuana use so we don't lose any more precious lives. I ask you this: why would you consider another recreational drug to be sanctioned by our lawmakers? Using and promoting drug use for recreational use is totally insane. Medical is enough to cause enough havoc. Let's put a stop to this marijuana train barreling down on us and put our families, our communities, and safety first. Please go to Facebook and join our page, which is Jennifer's Messengers, Sounding the Alarm on Marijuana, which has a lot of educational material in it, and our website, jennifersmessengers.org. And thank you to the Center for Christian Virtue for inviting me to speak here today, and for all of you for listening to my story. Thank you so much.
Here today. My name is Jody Salvo. I direct substance use prevention services for Ohio Guidestone, and I also chair the Tuscarawas County Anti-Drug Coalition. I am an Ohio certified prevention consultant, and I would be remiss if I do not help persons in attendance and learning about this issue to really understand marijuana today. We're hearing from our presenters, higher potency, different chains of forms of marijuana. So I think everyone needs a marijuana and addiction 101 to really understand this issue clearly. So adult use of marijuana back in the 80s and 90s, the percentage of THC, that's that psychoactive ingredient that gets you high, was anywhere from 2 to 4%. In 2020, it's anywhere from 10 to 18 to 20% in our communities, and that would be like the smoke joint that you would see. However, with legalization, we have seen forms of marijuana use change. So, not only do we have that dry marijuana, that dry bud in the joint, but we have different forms. We have oils, we have vapes, we have marijuana concentrates, and the THC levels there are anywhere from 20% all the way up to 99%. So this is what you need to know. Marijuana is not what it used to be. So a lot of adults that are hearing these talking points from those that want to commercialize, that want to make profits off of the marijuana industry, are telling adults, it's not a big deal, you know, it's safer than alcohol, and there's all kinds of information and talking points that are just not supported by research and science and outcomes from states that have legalized. So our young people, you know what, they're not looking to smoke a joint. They're looking to vape. They're looking for edibles. They're looking more towards like a marijuana concentrate, and they're new words for adults. Those concentrates are dab, they're wax, they're butter, they have high potency. So what does that mean? It is not the same drug. So our young people, you also need to understand Addiction 101. The younger a person is when they use an addictive substance, the greater the chance of them becoming addictive. So young people that use marijuana under the age of 18 are 4 to 7 times more likely than adult to suffer from a cannabis use disorder, marijuana dependence, go on to use other substances. So, as a prevention professional, our field is committed to healthy families, healthy communities, and empowered young people. If us as adults do not really take a stand on this, I will tell you we are going to see more and more young people initiate substance use. In Ohio, we are riddled with drug addiction, overdose, death. It is something that we battle every day in our communities. So the thought of legalizing another drug that can be that initiation ramp for our young people is just horrifying to me. And I'm sorry to kind of say it with that passion, but what I need you also to understand is our young people were marketed vaping devices probably around 2017, 2018. And as they started using those vaping devices, they had nicotine, they became addicted, and at much younger ages. We had young people, we do have young people in our middle schools, 12, 13, 14, initiating that nicotine vape device. But you need to know there's cannabis oil that you can put in that vape device, and our middle schooler and high schoolers are using marijuana at ages younger than they ever have before, and because it's potent, there's a much greater chance of addiction. So again, why does this matter? We're gonna bring on a whole bunch of young people that might struggle with addiction. And you need to realize, what does marijuana impair? Judgment, attention, memory, cognitive brain function. What do our kids need to do? They need to learn right now. We need our kids to be successful in school so they can go on into careers. We need safe workplaces. If our young people are already addicted to substances, it's going to be hard for them to be gainfully employed and protect our businesses and workplaces. Honestly, I could go on, but what I really challenge adults to do is to learn more about this issue, learn more about potency, learn more about addiction, learn about those that want to commercialize, because it is about profits. It is selling a substance of addiction, just like alcohol and marijuana. The profits we gain from substance of addiction will never outweigh the societal cost. So again, I just urge you to learn more about this issue. Thank you.
Before we have our next speaker from Smart Approaches of Marijuana come up, I know those that are on our live feed cannot see all of the headlines that are up here, so I just thought I would read some of them off real quick. And again, these are headlines that are taking place, making the news in a lot of these other legal states. Drug use is forcing Colorado employees to hire out-of-state employees, the Gazette, March 24, 2015. New York employers can't drug test most workers for marijuana, state announces New York Post, October 19, 2021. Opioid death rate acceleration in jurisdictions legalizing marijuana use, JAMA International Medicine, September 2018. How Colorado's marijuana legislation, legalization strengthened the black market. I'm hearing around the State House and the right now that, because we're legalizing, there'll be no need for the black market. As you'll hear from our speaker here in a moment, it's just the opposite. Every state that is legalized has seen an increase by far in the black market. California proposes slashing pot taxes, so all of those tax revenues that we keep hearing, this program being sold by. California proposes slashing pot taxes to help regulated industry compete with the black market. 6-year-old overdoses on THC gummy. Mom says companies are targeting kids. We're not just opening the door to, again, grandma's 4 or 5% weed. What we're opening the door to is an industry that thrives on young users. They thrive on people who are lifetime users, heavy users, and you produce a heavy user by young users. And so you market to them through social media. Marijuana worse for teen brains than alcohol, study finds. NBC News, October 3rd, 2018. AAA, the insurance company. AAA, in opposition of marijuana legalization, expects increase in traffic fatalities. Marijuana is now involved in more than 1 in every 4 road deaths in Colorado. Family, we cannot allow this to happen. Marijuana is bad news for Colorado. It was bad news for New York. It was bad news for California. It was bad news for Michigan. And it will be bad news for Ohio. Please welcome our speaker from Smart Approaches to Marijuana, Will Jones.
I'm Will Jones. I'm the Director of Community Engagement and Outreach at Smart Approaches to Marijuana. We are a national bipartisan organization that works on marijuana policy. And I'm here today actually from Washington, D.C. That's where I live and actually work. But just to kind of say why I'm here in Ohio and my concern why I'm so vocal on this issue, just going to paint a picture for you briefly on why I started working on this issue and what continues to fuel my speaking out on this issue today, and again, why I'm here. In 2014 in Washington, D.C., we had already decriminalized marijuana and we had medical marijuana, both of which I think are some progress in terms of the punitive past harsh laws that we've had on marijuana policy. No one should go to jail or get an arrest record simply for smoking a joint. So those were positive steps forward. But then the next thing was legalization and commercialization of marijuana in Washington, D.C. And that's when I began to speak out because we have legislation titled Regulate Marijuana Like Alcohol. And I think I've read a similar title here in Ohio. And for me, where I lived at the time in Washington, D.C., if you were to come to my house and walk out the front door of my house in any direction, the first store that you would get to would be a liquor store. You could go a little bit farther and get to a convenience store plastered with advertisements for tobacco, alcohol, and the lottery. This is the reality in communities like mine still in 2022. A study out of Johns Hopkins University showed that there in Baltimore 8 times as many liquor stores in minority communities as other places. And so when we say regulate marijuana like alcohol, that set off alarm bells in my mind because I hate what we've done with alcohol. Big tobacco has continued to disproportionately target disadvantaged communities with their products, and now we're seeing investments, billions of dollars from big tobacco companies, from alcohol companies. Altria, parent company of Philip Morris, has invested billions of dollars in the cannabis industry. We've seen big alcohol companies like Molson Coors, Heineken, Blue Moon, all of these companies, Corona, they have invested hundreds of millions and billions of dollars collectively in the cannabis industry because these are addiction-for-profit companies. People know that, for example, smoking is bad now, and these big companies, they're not just going to go away and let their business go away. They have creatively come up with a way to continue to get their profits from society. Now this is the new frontier for them. But what has really motivated me particularly to speak out is how they have really appropriated issues of social justice as a cover for their profit. And I want to speak to a couple of those issues because I've heard them just going across the country. We had these discussions in DC, and I've seen them across the country where corporations and movements are appropriating social justice issues, again, for profit. We hear often in DC, there was a slogan that said, legalization ends discrimination. And I just have to say, if that's your understanding of discrimination in our country, you have a shallow and naive at best understanding of the systemic issues of discrimination and racism that exist in our country. But the thing is, when we look at what marijuana has actually done and what legalization has actually done, it has failed with the promises that have been made in that area as well. We have heard from the president of the Minority Cannabis Business Association, and this was in an article in NBC News, and he said, the article was titled, Legal Marijuana Made Big Promises on Racial Equity and Fell Short. And he said, time is really up on selling your business dream as a social justice movement. This is from the president of the Minority Cannabis Business Association. Because in state after state after state that has said we're doing this for social justice, that said we're going to see equity in the industry, it has failed in every single state so far that has tried. It's less than 5% nationally. We've seen ownership by entrepreneurs of color. In fact, from the this is a headline from California. California, from New Jersey, from the African American Chamber of Commerce in New Jersey. They said in the 10 years of legalization, they're counting medical as well, not one black-owned cannabis business has been granted a license. And then in California, from the National Diversity and Inclusion Cannabis Alliance, said people had dreams and hopes of building generational wealth, and it's done just the opposite. It's ruining lives at this point because there's these promises that have been made, expectations that have been set up, frameworks that have been promised, but these are just, again, by companies, big tobacco companies, alcohol companies that are appropriating issues of social injustice for profit. Yet when we look at the data of what's happening, the business equity is not moving forward, and then even when we're looking at things like arrests and things like that, legalization has not solved that. In fact, in places like Colorado, we've seen that since they legalized, the arrests of African Americans have actually increased each year and have not decreased. And I don't have time to go into why that is, but that's just the data. You can look at it at colorado.gov, look at the data from there. And we've seen that in state after state. In fact, in DC, our prison population was declining for several years prior to legalization. And then the year that we legalized, it began to increase. And so these promises that have been made have been falling short time and time again, because what's at issue here, again, and I want to be very clear about this, is companies looking to make billions of dollars of profit are utilizing any and every excuse that they can to do that. But once legalization passes, all of the promises go away, and we're left with the consequences. For the health consequences, I mentioned some of the things about business equity, and also just the last thing I want to point out, just as we've seen, and this is how I started out when I worked on this issue, and I painted that picture when I started talking about liquor stores being the closest to my house in any direction. We've seen that in states that have legalized. Colorado, one pot business for every 47 residents in minority communities. More pot shops than Starbucks and McDonald's combined. So I say, imagine you're walking down the street. Every time you see a McDonald's or Starbucks, replace that with a pot shop, and that's what we're talking about when we talk about legalization and commercialization. And so I urge all legislators that are here, people that work in the area of policy, people that are working in the community, let's be honest about what's happening. Let's spread the truth about what's happening. Let's educate ourselves about what's happening and push back against these corporations that are looking to exploit us with their addiction for profit models of business.
Well, good morning. Thank all of you for joining us this morning for this press conference. Thank you, CCV, for hosting this. My name is Reggie Stolzfus. I'm the state representative for Ohio's 50th House District. And what is missing from our society today is truth. And I'm here to bring some truth to all of you today. My campaign slogan has always been, strong families equals a strong Ohio. Legalizing marijuana in Ohio will weaken families, and it will no doubt weaken Ohio. I have many concerns with legalizing marijuana. My biggest concern is the effect it will have on children and teenagers who will be exposed to this drug and use it. Marijuana is a gateway drug. There's no doubt about that. Our kids have it hard enough growing up in today's society. Why would we want to further burden them with more potential for marijuana use? States that have legalized marijuana have seen adolescent marijuana use skyrocket. Is this what we want for our Ohio children? Ohio also needs to be prepared for more traffic deaths should it legalize marijuana. If you look at Colorado, a state that has legalized marijuana, 1 in every 4 traffic deaths involves marijuana use. The Ohio legislature currently has a bill pending that deals with distracted driving. And at the same time, we would consider putting many more drivers on the road impaired by marijuana. I've heard the argument over and over again, the tax dollars will flow into our state. This is simply not true. Again, if you look at Colorado, for every $1 that is taken in on marijuana taxes, the state spends roughly $4.50 to counteract the effects legalization has had on their state. Former Colorado Governor John Hickenlooper was quoted, quote, "Marijuana tax revenue is a drop in the bucket. It is not going to pay for early childhood education or solve any big social ill. End quote. The fact is, we have many drug rehabilitation centers across Ohio that the state funds. And the state will be shelling out much, much more money to these centers if marijuana becomes legal. I have also heard the argument, decriminalizing marijuana will keep people out of jail. How about instead of walking laws back because people are unable to follow them, we teach people to obey laws and become productive members of society. The root cause of drug use and crime is from the lack of morals in our society and the breakdown of the nuclear family. Yes, a mother and a father raising their children, not a nanny state. If we can get back to these basic principles, far less people will find themselves incarcerated. Finally, there is a labor shortage, if you have not noticed, in Ohio. And legalizing marijuana would only exacerbate this issue. More people would be ineligible to work, forcing social programs such as unemployment and Medicaid to pick up the tab. Work-related injuries would rise, along with BWC payments and premiums for employers. This would be bad for our businesses throughout Ohio. Members of the General Assembly must take a stand for what is right and not be pushed around by a few special interests that want to lead our state down the wrong path. Again, thank all of you for coming out today, and thank you, CCV, for hosting.
Good morning, everyone. My name is Barbara Clark. I am a recovered addict. I'm also involved in many things throughout the community. I've been sober for 18 years. I get up every morning working on my recovery. I work with families who I see every day raising their grandchildren, their great-grandchildren, because their children have wandered off into a world of addiction. I started with marijuana, and it escalated to 18 to 20 years of using. It brought me down. I had 4 children. I didn't smoke weed before my children. I think my baby was 3 years old when I began to experience. So their whole life, their teenage life, I was on drugs their whole life. Started with just that marijuana. My son got a scholarship to the University of Hawaii. Nothing I done, the grace of God. And I couldn't even support him there, starting off with that marijuana. I see every day what marijuana is doing to our community, what drugs is doing to our community. No more. You would not bring any drugs in our community that's going to destroy our families. I will be out there. People in recovery will be out there making sure that we save our children. It is our responsibility. Once we vote, we can't take it back. So we're going to say no. I worked with them a few years ago on issue 1 when they wanted to make heroin and fentanyl misdemeanor. I said, the devil is a liar. Not in my community, because I know what it done to me. I'm the president of the Black Women's Voters League, where I educate families on the power of their vote and how it affects their household. Legalizing marijuana affects every household. Every household. We don't want our children out there struggling with drug addiction. We see every day 18, 19-year-olds just living on the streets because they're smoking marijuana that they're putting everything in. It's not like the marijuana that was back in the day. The marijuana today is a target. Is a target for our families, for our children. It doesn't matter what race, it doesn't matter what age, it doesn't matter. People who are trying to legalize this are criminals. It's legalized drug trafficking. So we want to make sure that we understand this legalization of marijuana and how it affects us. Denver told us what it did to them. California told us what it did to them. We can't be that stupid. You won't look at our community and say we got them, because we got you. And also, they're going to make this marijuana legal. It's a gateway to prison. It's a gateway to prison. And I've asked my friend, Mr. Lowry, to come and speak about that. He's an administrator, a retired administrator at the prison.
My name is Larry Lowry. I recently retired from the criminal justice system after 25 plus years, both the adult system and the juvenile system. 15 years in the adult system, 10 years in the juvenile system. But more importantly, I too am a recovering addict. I celebrate a little over 29 years clean from drugs and alcohol, and also I'm an ex-offender myself. And I can tell you, just working, and today I'm a licensed clinical dependency counselor at a treatment center, and I work every day to assist men and women to fight this thing we call addiction. I see that 95% of the people that come in for treatment and during the assessment phase start off with marijuana. So let's make it perfectly clear, as someone just spoke before me, marijuana is a gateway drug. I myself started off with marijuana, and it escalated within a year. I found myself using drugs intravenously in less than 1 year from smoking a joint. So I say, let's fight it with everything that we have. The prison systems are loaded with people that started with marijuana. 95% of the juveniles that came in, I met with every juvenile that came in the system. I had to talk to them first prior to them coming into our building. And 95 to 98% of the juveniles that came in during their assessment period discussed how they started off using marijuana prior to them getting a criminal record. And I've also seen the same statistics in the adult system. 95 to 80 to 98% of the inmates that was incarcerated came on drug-related charges. Either they were selling drugs, using drugs in some form or another. And after talking to them for a short period of time, they too also started using marijuana first and escalated to harder drugs that eventually turned into issues of crime. So I say, let's do everything we can in Ohio to do everything we can to stop the legalization of marijuana, because it will continue to create criminals, continue to create addiction, and continue to create problems in our state. So if you want to take it from someone that's been there, make no mistake, let's say no.
So, just a few things to wrap things up about what we've done here today. First and foremost, earlier today, a number of folks up here signed a letter with CCV that we sent to the General Assembly along with Governor DeWine, encouraging them to reject this initiated statute. We'll fight this out. If they want to go to the ballot, we'll fight it out of the ballot. Like you've heard, they might be able to go hire high-priced lobbyists, and they might be able to spend all types of money, but it's going to be throwing money into the wind, because when families hear what marijuana actually does, this thing is going down, and it's going down hard. I also want to thank the members of the General Assembly who are standing up here with us. I see Representative Hoops, Representative Flake, Representative Powell, Representative Pitt, I want to thank Governor DeWine for already making a very strong statement in opposition to recreational marijuana. Again, don't waste your money here. Go elsewhere. And the last thing I would just say to anyone who's either advocating for this at the State House or is supporting this in the community. You know, I see our friend here from Stowe Mission, Brad from Stowe Mission that's up here. Before you vote on this, go down Walk Parsons Avenue and see what it's doing. See what marijuana has done. And tell me this is a harmless drug. Go walk down West Market Street in Warren, Ohio, where I'm from, where I got marijuana when I was a kid. And I saw friends of mine start smoking marijuana with me who ended up on harder drugs. By the grace of God, that's where it ended for me, and I was able to move on. I had a great family system that brought me back from that. But there were so many other kids that were my age that didn't get it. Go walk down through Cleveland or Cincinnati, or go down to Portsmouth and see the places that are packed full of opioid users who started on marijuana. I just beg of you, set aside the rhetoric, set aside the what's the harm, set aside the, this isn't a big deal, I smoke a little weed, it's not a big deal. Just set that aside just for a moment, please. Please. And go see the faces, see what this is actually. Go to Colorado and go to the communities and see what the profits these marijuana companies are bringing in are from the most disadvantaged people that have the hardest situation already. We're going to tell that story all across Ohio. We're going to bring this thing down. It's going to come crashing down and send a resounding message that marijuana is not welcome in the Buckeye State. And I encourage folks to stand with us. Go to ccv.org. You can read the letter that we sent to the General Assembly. And this is just the beginning of the campaign we're going to be waging. Us and friends and other organizations all across the state to get the word out about what marijuana has done. With that, we're happy to take any questions. Yeah, so again, the question is how much money will we have to raise? Honestly, for us, from our perspective, like I said, in 2018, when they tried to push issue 1, they had $16 million that was reported that we know about that they spent, and 90-some% of that came from Silicon Valley. There was much more spent from outside groups, C4s, those types of things that spent on this. I think the No campaign had about $2 million or something like that, and again, it went down 2 to 1. So what you saw in that situation is you saw the business community step up and really invest in fighting this. I think if this gets closer, you'll see that same response. From CCV's perspective, we do it the old-fashioned way. We just get the word out. We go church by church. We go community by community. We go district by district. And we just start the conversation. And it's amazing what you can see. And again, the best thing for us right now with this is that it's not hypothetical anymore. You see the headlines, right? We're not saying, oh, it could be this. We know what this will actually be.
For Representative Solicitus, there's been a Republican-led legalization bill in the House. Can you talk about what it's like in the majority caucus on support for legalization?
Thank you for the question. I believe there's 2 bills pending in the House for legalizing marijuana. I could not tell you how many members are supportive of legalizing marijuana in the Republican caucus. I would have to venture, if I had to guess, I would say it's minimal at best.
Any other questions for us?
When will this be on the ballot for us to vote on?
Sure, so there's no guarantee it will be on the ballot. It's a great question, when will this be on the ballot? So the initiated statute's now here before the General Assembly. They have 4 months to decide what they're going to do with it. They could, our encouragement to them, what we are talking to vendors about today and every day, is just completely reject it, don't touch this, because any form of expanded marijuana, as you've heard, the bottom line question here with any bill that deals with marijuana is, do we want more weed on the streets? Is Ohio a better place with more people smoking weed? No, amen? Right? It's pretty clear. It's not a better place with more people smoking weed. So our encouragement is reject this outright. If that happens, then the proponents who got the signatures, who led the initiated statute, would have the option of getting more signatures. Again, these guys, they're backed by big tobacco. They've got all the money they could ever want, so they can go get their signatures. If they want to go waste their money, they can. And then they have to go collect those in the summer, and there's a deadline, I think, in August that they have to get them by in order to be on the ballot. Again, we're happy to fight this out anywhere and make the message known about what this is, but our encouragement to everybody is let's just not waste our time. We've got some pretty big issues to be working on in Ohio right now. We've got some pretty big things to be celebrating, and Intel coming here. I'm sure the last thing Intel wants is more pothead employees coming into work. So let's keep the good news vibes going there and not bring them up here. Well, last question here, and then if there's any other questions from the media, we'll take those. Friendly questions, obviously, we're going to come to you as well.
What is their stance on this? I understand that medical marijuana is trying to be expanded for use with autism and some other problems. So are they on recreational.
Well, I'll say, some of the backers of the medical marijuana aren't necessarily the medical industry. Most of the folks that are backing, a lot of the folks that are backing medical marijuana are just the recreational folks. Again, it's the shell game they play. They'll say, let's expand recreational marijuana so they can build up a bunch of local money to be able to run the recreational. They've used the same playbook all over the country. We know what they're doing. And by the way, if they really wanted people to be able to get marijuana for medicinal purposes, one, they can get all the benefits of it already from pharmacies. But they could just go to the FDA to get certified. But they can't do that because the FDA is not going to certify any drug that you smoke. So all that to say, you see some of the headlines here of the medical industry. We have some medical professionals here with us today that have spoke to the harms the medical harms, especially that marijuana brings to children. And that's going to be the story we'll continue to tell. So with that, we're happy to answer any other questions out here, but thank you so much for being gracious with me.